This is Average Joe PT, and I want to say thank you, first of all my subscribers. Keep them coming. Keep them coming. I'm going to keep bringing that content. Hopefully information, hopefully a little humor to go along with it. Maybe some little talking points that you can talk to your family about, maybe that you could take on yourself. So I looked around the YouTube sites, and I'm looking at, all right, what can I talk about that hasn't been around a while before I talk about the weekend, which I'm going to be a little bit surprised. I think I'm going to bring some equipment home and go over some stuff that you can kind of simulate at home that we do in the clinic. But today, we're going to talk about spinal stenosis. We're going to pull it back a little bit. Going to take you out of the foot, the hip, the knee. We're going to go over the back one more time, at least for this episode, and talk about spinal stenosis. What is it? How can you treat it? What can you do? What are the do's and don'ts? Stay tuned. Here we go. All right, you hear that I'm always bragging about the towel, magic towel. Oh, my magic towel. Spinal stenosis. We're going to throw magic towel right out the window. All right. This is the only case that we're throwing magic towel out of the room. Only time, boys and girls. Only time. All right. Other than that, magic towel till the world comes home. All right. So, what I'm talking about is that spinal stenosis, all it is take the canal where the nerves come down through. Peekaboo, peekaboo, I see you. And as we age, remember I talked about as the degenerative disc, it flattens out. That space becomes smaller and smaller because that disc is flattening out. It's not a big space no more. And so that canal where those nerves come out can actually get smaller and smaller and smaller, as well as arthritis can start to get within that bone area. And the ligaments around the backside can get thicker and start to make that nerve that comes out through that area smaller. And that's basically what stenosis is. It can be an artery. You can have stenosis in a vein. Essentially, it's just a narrowing of a canal. But in this case, we're talking about the nerves that branch out from the spine. And so extending your back, not the smartest thing to do, especially if you're starting to have some leg symptoms, some tingling, buzzy, and all that. You might like a little bit of traction, which is pulling on that back. Just be mindful that you don't inflame everything else in the area by doing that. Some of those inversion tables or tilting tables can help, but it's very easy to get those flared up. We might talk an episode about that and be mindful of those types of techniques. Also, besides the magic towel, this is the only time I'm going to recommend that recliner chair where you're kind of rounded out a little bit. You got that rounded C, because that rounded C in your back that I always talk about, pretend this is the spine, all right? That's going to open up that space in that back and give those nerves a little bit more to breathe, especially when that canal is smaller. So if you can open up the back, it might open up that space a little bit and reduce some of the symptoms in your back. I'm going to give you a couple exercises you can do. Pretty simple. And then we'll go ahead. This is a short session. Spinal stenosis, short session. So, treatment number 1, heat. If you're having leg symptoms, ice it. Otherwise, moist heat till the cows come home. To the lower back, whatever hips bother you, the left or right. 15, 20 minutes, several times a day. When that stenosis and arthritic type issues that you're having, heat. So that's number 1. Number 2, we're going to give you some stretching techniques to do to open up that spine, but be comfortable. And we're just going to give you some gentle strengthening core stability exercises to do just to start you off and hopefully get you out of this pain issue that you're having, or just give you some information that maybe the doctor gave you. Oh, you got spinal stenosis. Like, oh, So maybe you can do some of this stuff before you go to the physical therapy clinic, or go to the physical therapy clinic and then also incorporate some of this stuff that I'm going to show you to do at home. All right, let's go ahead and do those exercises. Stay tuned. All right, folks. Exercise number 1. Pretty simple. I want you to do this in the bed. You can do this on the floor, but you're probably realistically gonna do this one in the bed. Numero uno, number 1. Lie your back, bring one knee to the chest. I want you to hold for about 30 seconds to a minute. You've seen this exercise before. This is gonna open up that back a little bit. And then switch and do the other side, 30 seconds to a minute. Next one you're gonna do, boom, double knee. Now you can hook above, or you can hook below. Some people like to hook below, it's a little bit easier, right? You're gonna hold for 30 seconds to a minute, come back down, knee stay bent, back supported, okay? And then repeat. Back up, hold for about 30 seconds to a minute, come back down, relax. Next one you wanna do, nice hamstring stretch. Okay, like I always say, you could use a towel just like the towel with this one. Kind of hold it if you're not strong enough or have enough flexibility in your arms. Third one, same thing, towel, or just use your arms like I am. Hold for 30 seconds to a minute, get a nice pull down the back side of those hamstrings on both sides. 30 seconds to a minute. That's a good one. All right, those 3, as well as if let's say your pain is more on the left side, kind of open up the back a little bit, keep your shoulders flat, and let your body go to the right. If the pain is on the left, it's going to open that spine and stretch out a little bit. Might not even go all the way. Go to the point where you feel a pull, and that's it. Don't go aggressive into it. If symptoms are on the left side, don't switch and go to the right because you're closing down the left side. Closing it down, remember, we don't want to make that canal smaller, we want to make that canal bigger. So the last thing you want to do is, if your pain's on the left side, is to go to the left. You go to the opposite and open that spine up a bit. So those are some basic stretches that you can do at home, 30 seconds to a minute. Try and do a couple of them. Try and do them a couple times a day. Do the moist heat first to the lower back, and then do these stretches, or a nice hot shower. Then do them. Let's do just a couple basic strengthening ones. All you're gonna do is pull your belly button back, belly button to the spine. It's the old style. Some people will also do what's called the TA, transverse abdominis. They'll get their little bony hips if you still got them. I'm losing mine as I get older. All right, and you can go ahead and just kind of pull in. That's one of those things where you kind of tighten in. You should feel those bones, and you should, when you do it correctly, you feel the muscle pop out into your fingers. That's also another nice one. But the easier one of the two is just bringing your belly button to the spine, flattening your back down into the bed. It opens up that spine a little bit. You hold for 5-10 seconds, relax, and do like 15 or 20 of those. That's a simple, basic core stability exercise. When it seems like that's pretty easy, the next advancement to that is what we call pelvic tilt with a march. You keep your back flat, bring one leg up. The whole time that you're bringing your leg back down towards the floor or to the bed, you keep your back flat. Don't let your back roll forwards. Keep it down flat, and then switch and do the other side. Obviously, your head is rested the whole time. You don't want to get a neck issue. But I'm doing it so I can see me talk, obviously. But you do that, and maybe you do like maybe 15 or 20 of those, keeping that back nice and flat as you're actually doing that exercise. So that's a couple core stability exercises, stretching, some heat, sitting position to help reduce that stenosis type symptoms. So, like I always say, subscribe, all right? I'm here, I'm bringing the content. This is free information. This is a little bit of education, a little bit of humor, a little bit of exercise, understanding why you're doing this. That's gonna help you in your home. Bring your friends. Subscribe, baby, subscribe. All right, and like I said, this weekend, I think I'm gonna go ahead and bring maybe a few things home and give you some idea what you can simulate what we do in the clinic. So until next time, look up and keep smiling.